Hey everybody, this is Alec with Home and Rehab, and I want to talk to you guys about something that actually just came up today in one of my evaluations, and it's the importance of understanding the resiliency of the human body. It's kind of a really cool thing that actually happened during 2 evaluations today, but it can be very, very important to understand just how amazing your body is at recovery so that when you are going into any sort of rehab, you understand how good and hopeful your outcomes are. So, with both of these patients, what we are talking about is a history of fracture, one of them very recent and one of them a long time in the past. But what happened was they were very, very worried about their bones breaking again just by putting weight on them. And thankfully, that's not something we have to worry about. And I actually used myself as an example because when I was younger, I broke several bones. It's a result of a couple different accidents, most of them sport related, but one of the most obvious ones is the one in my wrists. Both of my wrists actually look very, very different because of a major fracture that occurred on one side. And what I did was I presented both of my wrists to my patients without telling them which one was the broken wrist. And I asked them which one looks stronger. And they both pointed to my left wrist, which happens to be the one that I landed on when I was a kid riding my bike. Bike went out from under me, landed on that thing, and that sucker snapped. But the good news is it healed great. You can't really tell right now what's going on with it, other than the fact that it actually looks better than the other side. Reason being is very simple. My body knew that I was probably going to break it again. It built it back stronger. That's what tends to happen when we have injury in the body, is not only does our body repair us, it actually tries to build us up in a way that prevents future injury occurring to that same tissue. We call it the SAID principle, specific adaptation to impose demands. Whether that demand was gradual over time, like what we're doing in exercise, trying to build up our muscle, or whether it's an instantaneous injury. When our body tries to repair us, it tries to repair us in a way that builds us back better. That way, when we are re-exposed to any sort of similar impetus, our body's better prepared for it. You can see the same thing in your skin if you've ever had anything that caused a scar. Scar tissue in and of itself is extremely strong and durable. And we don't just build it back up because our body can't build skin anymore. We actually build new skin all the time, and most of the skin cells on your body aren't going to be there in a little bit and replaced by something brand new. So why do we scar up? Well, you've had an insult to the tissue and your body doesn't want it to happen again. So it's going to put something there that's stronger, that's less likely to tear, break, or rip. Why? Because it's important that it stays in one piece. But that level of resilience is extremely important to know about. Because if I've had a history of injury in a bone and I'm afraid to use it, well, you've heard if you don't use it, you lose it. Now all the muscles around that joint are going to go unused. Now I can't support the joint, so no matter how strong I made that bone, if I go against something in the future and I try to react, I'm more likely to injure something in that immediate vicinity. We actually think that might be one of the reasons that re-injury in an area is more common. So one of the things we look at for somebody who has, for example, a history of an ACL tear, their likelihood of injuring the opposite knee or some of the ligaments in the same knee is actually greater than before the injury. And we used to think, oh, well maybe that's because whatever predisposed them to this one might be occurring in the other side. And we think it might also have something to do with the fact that if I'm afraid to use my right knee, I'm going to put all the force to my left knee now. My left knee didn't build back up like my right knee did. It's not ready for this increase in load, and now I'm putting it at injury risk. So, understanding that my body's built up better, I might actually have more odds of using my body correctly. So I'm in that same sporting scenario, I'm going to be more likely to use my legs equally. We call it kinesiophobia, fear of movement. When we develop a high kinesiophobia, we actually tend to use our body in a different way that predisposes us to further injuries. So making sure that we as practitioners, but also ourselves as patients, are very understanding about how resilient and adaptable our body is can be a huge thing when it comes to our outcomes. If I'm less afraid of my body and more willing to use it, I can build myself up even stronger than before, making myself exactly what my body's trying to be, more able to withstand future injury. But we have to know about this first. If you didn't know that your bones built back up stronger, it's going to make you naturally more afraid to use it, which again, naturally makes us more likely to injure something else in that area in the future. So, what's our big takeaway from this? It is, understand your body is really cool. Your body is capable of repairing itself in many ways that a lot of people aren't even aware of. And knowing that it's that capable of repair can be a huge deal when it comes to making yourself ready for the future and getting out of rehab faster. If you're less afraid of your leg, you're more ready to do those exercises sooner, you're out of my office even sooner, making your recovery rate even better. So, whenever anybody starts any of their rehab here in this office, I always try to start with making sure they know about this. But coming in already understand it could be a great boon to you. You might be even better ready to come out here faster. And that's always my hope. Get people back to themselves as quickly as possible. Have a great one, guys, and we'll talk to you soon.